When it comes to explaining to patients the need for catheterization, I try to explain to them, like, one, I show them the catheter. I also tell them, like, look, this catheter is going to be in for a short period of time. We have instructions that we give our patients. We also try to do things to make it as comfortable as possible. So make sure that it's not on stretch. We explain catheter care. And for a lot of patients, when it's dealing with a catheter for, somewhere between 1 to 3 days or a shorter period of time, most patients are willing to tolerate it. I think what ends up being the greatest challenge is when sometimes people think catheter, they think that catheters, indwelling, is it ever going to come out? Is going to be a long-term issue? So I think that's where it can play a huge role. But a lot of times when I explain to patients that catheters will be a shorter period of time, call it a few days, most patients are willing to tolerate it. When I introduce BPH procedures to my patients, I explain upfront which procedures will require catheters, what procedures are done in the hospital versus which ones are done in the office. I also try to be very transparent about the fact that, look, immediately after the procedure, your prostate may be a little angry at us, regardless of what procedure we chose. And during that time, we're dealing with inflammation, discomfort, bleeding, whatever it might be. That catheter can be, quite, can be helpful during that post-operative period. I think once you define upfront what your experience has been of, like, how long that catheter is going to last, that does help tremendously in easing the patient concern about long-term catheter use.